Hi everyone! In today's video, we're going to learn about how to measure blood pressure using a manual blood pressure cuff, also known as an Aneroid Sphygmomanometer. This is a most-known skill for anyone in a medical field, so let's get started. But before we begin, it is important to understand the tool we will be using to measure blood pressure. Here we have an Aneroid Sphygmomanometer. This device has several main parts. First is the cuff, which is wrapped around the upper arms, and then one side of the cuff has a smooth surface that should face the patient's skin. Next, we have the tubes or rubber hose that connect the cuff to the other components. Then we have the inflation bulb, which is used to pump air into the cuff. Attached to the bulb is a valve that allows us to control the release of air. And finally, we have the gauge, also called a manometer, which shows the air pressure in millimeter of mercury. We also use a stethoscope, which consists of earpiece, tubing, and a chest piece to listen the cuff sound when measuring the blood pressure. Now that we're familiar with the tool and its function, I'll show you exactly how to use it to measure blood pressure step by step.
First, make sure the patient is in a comfortable position, either sitting or lying down. If the patient is sitting, their back should be support. And their feet flat on the floor. The arms should be relaxed and placed at heart level. Roll up the sleeve to expose the upper arm. Ask the person to rest for about 5 minutes before starting the measurement.
Ma'am, please rest for 5 minutes before I check your blood pressure.
Yes, please.
Second, applying the cuff. Wrap the cuff snugly around the upper arm. Place it about 2 to 3 centimeters above the crease of the elbow. Make sure the cuff is tight but comfortable. Next, place the stethoscope chest piece lightly over the brachial artery. The brachial artery is located just below the cuff on the inside of the elbow. Next, measuring blood pressure. Close the valve on the inflation bulb. Squeeze the bulb to inflate the cuff until the pressure gauge reaches about 20 to 30 millimeters of mercury above the expected systolic pressure. Usually, this is around 160 to 180 mercury. Now, slowly open the valve to release air from the cuff at a rate of about 2 to 3 millimeters of mercury per second. Listen carefully through the stethoscope for the first stepping sound. This sound is called the systolic pressure. Keep slowly releasing the air and listen for when the tapping sound disappears. This point is the diastolic pressure. Remember to record both numbers. After you finish, fully deflate the cuff and remove it from the arm.
stethoscope if needed, and store the equipment properly. If necessary, repeat the measurement to ensure accuracy. So, measuring blood pressure manually with an Aneroid Sphygmomanometer takes practice, but it is an important skill. Good luck and stay healthy. I am Laksmi Poni, a midwifery student. Thank you for watching.